بسم الله الرحمن الرحيم. الحمد لله وحده والصلاة والسلام على من لا نبي بعده. أما بعد, Assalamu alaikum wa rahmatullahi wa barakatuh. I am Dr. Zakaria Guennoun, consultant in diagnostic radiology, currently practicing in Saudi Arabia. Is there a better way to diagnose pancreatitis than on CT? CT scans are valuable for assessing the severity of acute pancreatitis. The CT Severity Index, CTSI, developed in 1990, is a widely used scoring system based on pancreatic changes and fluid collections. It includes a method for estimating the extent of necrosis. A later version, the modified CTSI, simplifies scoring, but also considers complications outside the pancreas. Importantly, studies have shown that both CTSI and modified CTSI are as effective as a different scoring system, like APACH 2, in evaluating acute pancreatitis severity and predicting the need for medical intervention. The revised Atlanta classification categorizes pancreatitis based on the presence of necrosis. Acute pancreatitis can be either interstitial or necrotizing, with necrosis indicating a more severe form. CT scans are the gold standard for diagnosis AP due to their speed, availability, and image quality. So where is the problem in this situation? First, CT scan involves radiation and potentially harmful contrast agents for some patients. Moreover, unlike necrotizing acute pancreatitis, mild acute pancreatitis or interstitial pancreatitis shows normal enhancement on CT scans. Also, they could miss early necrosis, requiring repeat scans later. That's where MRI is becoming, in certain situations, a better alternative to CT scans for diagnosing acute pancreatitis. While MRI was previously limited by slow scan times and difficulty with uncooperative patients, advancements have made it faster and more effective. MRI offers many advantages over CT scans. It avoids radiation exposure, provides higher soft tissue contrast for better diagnosis, and allows for a more comprehensive evaluation of the pancreas and bile ducts. This makes MRI a valuable tool for not only diagnosing AP, but also assessing its severity and potential causes. Specific MRI sequences, out of phase and fat-saturated T1, provide clear images for evaluating pancreatic size and shape. Inflamed pancreatic regions can also be easily detected thanks to the contrast resolution of MRI. MRI also excels at detecting fluid collections and distinguishing between fluid-filled collections and necrotic tissue due to its superior ability to show internal content. But the most interesting sequence in MRI is diffusion-weighted imaging. It's quick, doesn't require contrast, and works by measuring the movement of water molecules in tissues, which can reveal information about cell health. The strength of this signal is adjusted by a B coefficient. Diffusion-weighted images can be used to differentiate between cancerous and non-cancerous lesions by measuring the apparent diffusion coefficient, ADC, a value that reflects water movement. This technique is particularly helpful for examining pancreatic masses. Certain authors recommend using diffusion-weighted images with at least 4 different B values to get the most accurate results. In fact, there are multiple studies which show that diffusion-weighted images can be a helpful tool for diagnosing acute pancreatitis. Specifically, diffusion-weighted images can detect AP even in early stages when CT scan might be normal, meaning that even when CT scans are inconclusive, diffusion-weighted images can detect interstitial pancreatitis, showing diffusion restriction with low ADC values. So that's it. Just remember the value of MRI and especially diffusion sequence to diagnose acute pancreatitis, either the severe necrotic form or the mild interstitial one, especially in those situations where you cannot do CT scan.